Namaskar दोस्तों, good evening friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist, and you are watching Dr. KK Med Talks. आज के हमारे नॉन स्टॉप शो का 775वां 775th एपिसोड है. Let's have the headlines for today. आज है 14th November. Today is 14th November, 14 नवंबर है. It is Children's Day, so best wishes to all the children of India. It is also World Diabetes Day. एंड इसीलिए हमारा आज का टॉपिक है जो बच्चों के लिए भी है और डायबिटीज वालों के लिए भी है. इसलिए वी आर ड्रेस्ड इन ब्लू एज वेल, क्योंकि ब्लू जो है ये कलर होता है डायबिटीज का. तो ये हमारी पहली हेडलाइन थी. विशिंग एवरीवन सक्सेसफुल, फ्रूटफुल, मीनिंगफुल वर्ल्ड डायबिटीज डे व्हेयर वी कैन एक्चुअली मेक अ डिफरेंस. SMS Hospital has reported that type 2 diabetes can go into remission, and they have done that in 46 patients through weight loss, also through changes in lifestyle and eating habits. The International Diabetes Federation has said that India will have more than 92 million people. 92. थोड़ा सा और आगे जाते तो 10 करोड़ पे पहुंच जाते. 92 million people living with diabetes by the year 2030. And a study has found that 1 out of every 5 Mumbaikars, so that means हर पांचवा मुंबईकर, adult मुंबईकर has diabetes. Diabetes is associated with many diseases. One of them is dementia. And Roche की एक दवाई थी which was going to work on Alzheimer's disease, जो लोग जल्दी भूल जाते हैं, but it has unfortunately failed to meet its goal. तो हमें खुद ही याद रखना पड़ेगा सारी चीजें. I mean, big challenge for me. भूलना शुरू कर गया हूं मैं, and दवाई भी नहीं कोई आ रही, so we'll figure out how to remember things. But before I forget, let's introduce our guest for today. हमारे टॉपिक क्या है वो देखते हैं पहले. Let's see what our topic is. So a very youthful topic and something that is apt for today's World Diabetes Day observation. Diabetes in the young. And इसके लिए जो हमारे गेस्ट हैं, बहुत ही यंग यूथफुल गेस्ट हैं. Let's welcome Dr. Karthik Balachandran. Warm welcome, Dr. Karthik.
Good evening, sir. How are you, sir?
Good evening. All fine. Dr. Karthik describes himself as an endocrinologist, that's a hormone specialist, who's helping patients find their hormonal yin-yang. So we'll discuss what that is. He's a consultant endocrinologist at the prestigious Sri Ramachandra Medical College and Research Institute in Porur, Chennai. His research interests include obesity and diabetes in the young. And you will find him a very active participant, not only in medical care, in endocrine care, but also in public awareness, in advocacy, in research, and in writing. And पूरा जो इंडिया का जो एंडोक्राइन फ्रेटर्निटी है वो सब इनकी कातिलाना राइटिंग का फैन है. एवरीबडी इज अ फैन ऑफ हिज वंडरफुल राइटिंग स्किल्स. So Dr. Karthik, warm welcome. On KK Med Talks, we have so many people logged in and so many people greeting you from across the country. Dr. Sanjeev Puri from Punjab, Dr. Meshpal Singh Pawar, our ever youthful pediatrician, Dr. Jay Prakash Sarswa, who is an MD in community medicine, Tilak Raj Sachdeva, and Dr. R.S. Chaudhary sir. Sir is a senior surgeon from Haryana, all greeting you. And they want to know what is special 14th November and what is the theme for this year's celebration.
Yeah, 14th November is observed all over the world as World Diabetes Day in memory of Sir Frederick Banting, who basically invented insulin. Today is his birthday. So to commemorate his birthday, we call it as World Diabetes Day. This has been declared as World Diabetes Day way back in 2006 itself. So for the last 16 years, we have been observing this day as World Diabetes Day. And this year's theme is Educate to Protect Tomorrow. So basically, it focuses on educational activities such as the one that we are doing right now to educate our patients, to empower them so that we can protect them, protect their tomorrow from the complications of diabetes.
तो जो आज का दिन है वो सेलिब्रेट किया जाता है वर्ल्ड डायबिटीज डे के तौर पे. पिछले 16 साल से कर रहे हैं, फॉर द पास्ट 16 इयर्स, एंड ये यूनाइटेड नेशंस द्वारा सम्मानित किया गया है. सो देयर आर many days in the world, but most of them are just started by various organizations. कुछ एक हैं जो वर्ल्ड हेल्थ ऑर्गेनाइजेशन अप्रूव करती है, मे बी 8 or 9 days like that, like they have वर्ल्ड हेल्थ डे on the 7th of April. बट यूनाइटेड नेशंस ने सिर्फ 2 days को मान्यता प्राप्त दी है, और दे हैव approved only 2 days. One is World HIV Day on the 1st of December, and दूसरा ये वाला है, which tells us the importance of diabetes to world health. डॉक्टर साहब ने ये भी कहा कि आज की थीम है एजुकेट टू प्रोटेक्ट योर टुमारो। तो अपना कल बचाने के लिए आज आप ज्ञान सीखें, learn from each other, and that's what we do at KK Med Talks. So, Dr. Karthik, so many people have diabetes. Now, the IDF says 92 million people living with diabetes. If there are 92 million people who live with diabetes, and I think at the most there would be 10 or 12 countries in the world, 15 countries which have more people than that. So, if everybody has diabetes, then doesn't it become normal? Why should we bother about it at all?
Yeah, the population of just the number of diabetes people in India would easily dwarf many countries' total populations. But unfortunately, diabetes, when left untreated, leads to complications and basically harms our tomorrow, one way or the other. So, to protect our tomorrow, we have to act today to empower ourselves, to educate ourselves, to take action so that our tomorrow can be better. So, diabetes, just because something is common does not make it normal. It is becoming increasingly common. Unfortunately, we have to bear the brunt of diabetes if we do not take action today. And that is why today's theme of educate to protect tomorrow is very, very relevant.
Hmm. Other people logging in, Sanjay Kesarwani ji, Bimla Kapoor madam, Anshu Singh ji, all greeting you and all agreeing with you. So supposing आपको ठीक दिखाई नहीं देता, आंखें खराब हैं, you have myopia, या मोतिया हो जाता है old age में, you get cataract in old age. Now everybody will get cataract in old age, but that doesn't mean you don't go and get operated. Many people are not able to see properly. That doesn't mean you don't go and get spectacles. So if a disease is common, it doesn't stop becoming a disease. In fact, it becomes even more important to handle that. So, Dr. Karthik, when we speak of diabetes, uh, there are some diseases which affect the individual, and there are some which go beyond that. So, would you like to draw any parallels? Would you like to compare and contrast COVID and diabetes? Both have been emergencies. How has our response been to both? Are we lacking
Um,
somewhere? Is there a bias in us against either of these?
it's a, COVID was an explosive onset pandemic. This reminds me, this comparison reminds me of the story of frogs in hot water. If a frog is just thrown into boiling hot water, it quickly jumps out of the hot water because it can immediately sense that the water is very hot. So it will do everything in its power to jump out of that vessel. But if the same frog is put in cold water and the water is heated slowly, slowly, slowly until it boils, the frog actually doesn't jump out but dies there, basically gets cooked. So the difference between a slow acting pandemic like diabetes and a quick acting pandemic like COVID is the difference between a frog that is doing everything in its power, frantically jumping out, and the frog that gets complacent and thinks that okay, tomorrow we'll see, and then ultimately it dies. So our response to diabetes has been yes, good, but unfortunately it has not been good enough to stand the increase in prevalence of diabetes. Our response to COVID has been tremendous, especially India has been able to, with huge population, severe resource constraints, we have done, I feel, better than many, many other countries. And we have to do the same thing with the same urgency and the same seriousness to diabetes as well.
तो कुछ एक emergencies हैं जो अचानक आती हैं, like COVID-19 came suddenly. That is like a terrorist attack. So we did respond, and we have done much better than almost every other country on earth. And कुछ एक emergencies होती हैं in slow motion. They come in slowly, like they are terrorists, but it's like a sleeper cell. You know, the sleeper cell keeps on growing and growing, and by the time you realize it's eaten into you, it's too late. That is how diabetes is. It's an emergency in slow motion, and we are trying, but maybe we can do better. Greetings to you, Dr. Karthik, also from Dr. Meenu Thakur. Madam is a senior gynecologist of Haryana, and also greetings from Poonam Kishore Verma ji. So, Poonam Madam, greeting you. So, we've understood that diabetes is it is like a terrorist, only it's in slow motion. It's like a sleeper cell. So, how does diabetes affect the young people? Why is our topic diabetes for the young today?
So diabetes at any age is a bad news. It is especially bad news when someone is young, when they have their whole life ahead of themselves, and the response of the patient is best captured by the patient's reaction when we break the news that he or she has been diagnosed with diabetes. They're shocked, they're initially in denial, they're scared, they wonder how long they're going to live. They sometimes ask if that disease will go to their children and so on. So, a young patient with diabetes is a serious problem because he's one of the primary contributors to our economy and that they are going to live for a much longer time with diabetes. So they want to play a long innings. Therefore, the sugar has all the more time in the world for it to do some damage to the internal organs. So, young patients with diabetes, we need to take their aspirations into account, their situation, and then treat them accordingly, while also taking care of their special needs. So they may be active, they may be moving from place to place, they may be in the early stages of building their career. So a lot of other things come into play while treating young patients with diabetes.
So diabetes is a chronic disease and it's going to remain with you. It can go into remission, we'll talk about that later, but still you have to be careful. And the younger the person who lives with diabetes, the more is our responsibility. क्योंकि उनको जैसे डॉक्टर साहब ने कहा लॉन्ग इनिंग्स लंबी इनिंग्स है अभी तो 100 साल की जिंदगी है यू हैव another 100 years to go so we have to keep those 100 years healthy we have to add years to your life and we also have to add life to your years दोनों चीजें इंपॉर्टेंट हैं इसलिए for younger people it becomes more important so Dr. Karthik you run a busy practice and you see people from all walks of life coming to you uh, anything that comes to your mind any story of success any story of sadness related to young people so we can put that this topic into perspective why is it that this topic is so close to our hearts.
Okay, so this one is quite close to my heart because this patient is a brother of my friend who got diagnosed with diabetes uh, maybe 1.5 years back. It was in the middle of the pandemic and he was diagnosed with diabetes, and he was pretty pumped because of the diagnosis, mainly because he was preparing for civil services exam. This was a young, dynamic guy who had spent a lot of sleepless nights poring over big books, trying to score as much marks as possible. And he was utterly shocked when he found that he had diabetes. Then we sat together and then decided that for a young person, we need to aim higher, and the highest aim is to get rid of diabetes in the first few months. That is to lose significant weight and aim for remission, which is what we do in many young patients. That their aim must not be to simply control the disease with tablets, but to ultimately go into remission with enormous effort. So he had worked really hard. He had nearly uh, continuous contact, low intensity contact with our team, the nutritionist, and so on. And he managed to lose nearly 12 kilos of weight. And lo and behold, his HbA1c had gone under 6.5%. And that basically gave him a confidence that anything is possible if we put our mind to it. And 1 year later, now I'm very happy to say that he has been selected as IFS, Indian Foreign Service. He wanted to be in the IAS, but anyway, he is now happy that he has conquered both diabetes and hopefully the minds and hearts of other people for the sake of our own country, maybe in some other country. So it is something very close to my heart.
Okay, and this is a happy news also, and it talks to us about the possibility of remission of diabetes if your patient has type 2 diabetes. So that's nice. And now these questions coming up. सुशील सिंधवानी जी बोलते हैं कि sir, insulin young patients are mostly insulin deficient. So let's take his question one by one. So the question here is this correct? Is this partly correct? And will every young patient have the same type of diabetes?
This is a very important question. I will have to address both parts of the question. Whether someone is insulin deficient or not depends mostly on the phenotype and the overall clinical picture on not merely on one variable like the age. So we assess the patient in a holistic manner to find out whether they have significant insulin deficiencies or insulin resistance. We can think of this as a kind of tug of war, a metabolic tug of war between insulin deficiency and insulin resistance. Even type 2 diabetes patients may be considered to have relative insulin deficiency, wherein they don't make enough insulin to keep blood sugars under control, but the primary defect is insulin resistance. Whereas in type 1 or type 1 associated conditions, the primary defect is not that the tissues are not responding, but that the pancreas is not producing enough insulin. So whenever we see a young patient, we try to slot it into one of these two categories. Is the patient not making insulin or is the insulin not working? Similarly, there are other rarer conditions where we look for extra pancreatic features. We will come to it later on in subsequently. So the basic framework that we want to convey here is that there are two kinds of diabetes. One in which it is primarily insulin deficient. Second, in which the primary problem is insulin resistance. And age is not the differentiating feature. In fact, these days, with increasing obesity, we live in an obesogenic environment. Younger and younger, even children are coming with type 2 diabetes. So we do not consider young age as absolute insulin deficiency. And with regard to his second question, whether insulin needs to be given or can I get the second question again, sir? I lost the thread actually.
So there are multiple questions that he has asked. So the first was, is diabetes the same in every young person? And you've answered that there are different types of diabetes, but जो मेन दो तरह की हैं, एक होती है जिसमें इंसुलिन बनता नहीं है, that is insulin deficiency जो सिंधवानी साहब पूछ रहे हैं, और दूसरा है जहाँ पे इंसुलिन रेजिस्टेंस होती है. इंसुलिन तो बन रहा है मगर इंसुलिन काम नहीं कर रही. इंसुलिन एक चाबी की तरह है. इट्स लाइक अ की. चाबी का काम है ताले खोलना, टू ओपन वेरियस लॉक्स. तो अगर चाबी नहीं होगी, दैट इज इंसुलिन डेफिशिएंसी, व्हाट सुशील साहब इज सेइंग. एंड दूसरा होगा इंसुलिन रेजिस्टेंस. जब ताले जाम हो गए, तालों को जंग लग गया, द लॉक्स आर नॉट ओपनिंग, दे हैव बिकम रस्टेड फ्रॉम इनसाइड, दैट इज इंसुलिन रेजिस्टेंस. सो इनको आसानी के लिए नाम दिया जाता है टाइप 1 एंड टाइप 2. बट लाइक डॉक्टर कार्तिक सेड, देयर आर मेनी अदर टाइप्स ऑफ डायबिटीज. So now Sushil ji goes on to the next question. C-peptide test. What is C-peptide? Does C-peptide help me differentiate between type 1 and type 2? या और भी कोई टेस्ट होते हैं करने के लिए? ज्यादा आसान टेस्ट, ज्यादा मुश्किल टेस्ट, easier tests and more expensive
Yeah.
tests also.
Okay. C-peptide is a measure of how much insulin we are producing in the body. It is basically co-secreted along with insulin. Instead of insulin measuring insulin, which has a short half-life, we can measure C-peptide, which can be used as a proxy for insulin. So if the C-peptide is low, we can say that insulin is low. If it is high, we can say that insulin is high. But the diagnosis of type 1 diabetes heavily depends on whether it is autoimmune or not. So the test to diagnose type 1 diabetes would be autoantibodies, which is there are four major autoantibodies, IA2, ICA, ZNT8, and GAD65, out of which GAD65 or glutamic acid decarboxylase, this GAD65 antibody is the commonest antibody which is done. But it is quite expensive. Where I practice, it costs around 4,000 to 4,500 rupees, whereas the C-peptide test is much cheaper, which is 700. Unfortunately, a C-peptide cannot reliably distinguish between type 1 and type 2 diabetes or other rarer forms of diabetes, especially in the younger patients. So, when we suspect type 1 diabetes, the test to do would be GAD65 antibody.
ये जो एंटीबॉडी है जो डॉक्टर साहब बोल रहे हैं गैट 65, एंटीबॉडी ऐसे देखते हैं लाइक लेट्स से यू आर प्लेइंग फुटबॉल. तो जब आप फुटबॉल खेलते हैं तो आप कोशिश करते हैं गोल दागने की दूसरी टीम के खिलाफ. यू वांट टू स्कोर अ गोल अगेंस्ट द अपोजिंग टीम. मगर कभी कभी जोश में हमारे प्लेयर्स जो होते हैं, अवर प्लेयर्स गेट एक्साइटेड और द बॉल सीम्स टू हैव अ माइंड ऑफ इट्स ओन. देयर वाज दिस फिस्ट ऑफ गॉड थिंग आल्सो इन वन ओल्ड वर्ल्ड कप. तो कभी कभी जो बॉल है अपने गोल पोस्ट में ही चल जाता है, सो यू एंड अप स्कोरिंग एन ओन गोल. ऐसे ही बॉडी में होता है. इन आवर बॉडी वी हैव अ डिफेंस मैकेनिज्म. डिफेंस मैकेनिज्म इज देयर टू प्रिवेंट इन्फेक्शंस और डिजीज फ्रॉम कमिंग फ्रॉम आउटसाइड. सो वी आर देयर रेडी टू फाइट द वायरसेस, रेडी टू फाइट द बैक्टीरिया. मगर कभी कभी वो जो फाइटिंग है अपने खिलाफ हो जाती है. यू एंड अप फाइटिंग योरसेल्फ. तो यदि वो फाइट हो गई स्किन के खिलाफ, तो फुलवेरी हो सकती है, यू कैन हैव विटिलाइगो। If that fight decides to, if those defense mechanism things they decide to fight the thyroid, तो फिर thyroid हो जाएगा. But if they decide to attack the beta cell that is in the islet of Langerhans, which is in the pancreas, agnacia में B cells होती हैं. If our defense mechanism decides to fight that, तो B cells destroy हो जाएंगी, and that is type 1 diabetes. And ये जो तत्व हैं जो लड़ाई करते हैं, जो सोल्जर्स हैं, that is the GAD antibody. So that is what we are trying to search. Sushil ji and Dr. Utsav, they continue with the discussion. So you've told us type 1 and type 2. C-peptide you can do if you want. Sometimes it is helpful, mostly it is not. GAD antibody might be a better way. But a GAD antibody bhi jo hai, that is expensive. And is it necessary? Is it mandatory that you need to do a GAD antibody before you begin treating type 1?
Absolutely not, sir. This is a very, very important question. Uh, Treatment of type 1 diabetes should not be delayed for doing any test except perhaps blood sugar. It should not be delayed for doing a C-peptide, for waiting for antibody tests or anything of that sort. So the antibody tests and C-peptide give clarity on the diagnosis of the disease. And that diagnosis can help in prognostication. What will happen to my child? What will happen to me if I have diabetes? So the patient will have a lot of questions. Why me? What should I do now? Can I get married? Will it go to my child? Will I be insulin dependent for life? Or can I stop it after a few months? These all questions will be there in the mind of the patients. And these questions can be answered by antibody tests and C-peptide tests. But before all that, the patient should survive to that extent that he these prognostic factors become important. So the initial few days of diabetes, our goal is to do two things. One is to establish trust and rapport with the patient so that he comes back to us for treatment for diabetes. Second is to control blood sugar to a reasonable extent so that we don't get into any serious acute complications. So these are the two major issues, and it should not treatment should not be delayed pending the results of antibody or C-peptide test.
सो डॉक्टर साहब जो बोल रहे हैं इसको इसकी अलग से भाषा में बात करते हैं. लेट्स पैराफ्रेज इट, लेट्स टॉक अबाउट इट डिफरेंटली. कुछ एक बीमारियां हैं जो अचानक आती हैं, दे कम सडनली, वापस भी चले जाती हैं, दे आर अक्यूट. अक्यूट कैन बी माइल्ड, इट कैन बी सिवियर ऑल्सो. छोटी माता आके चली गई, चिकन पॉक्स केम एंड इट वेंट. बड़ी माता आई, स्मॉल पॉक्स केम एंड इट टुक यू, अपने साथ ले गई. सो देयर इज अ फेटेलिटी. Whether it is mild or severe, it will just happen in a short period of time. आज की तारीख में देखें, if we look in today's world, खांसी जुकाम हो सकता है, you can have a cough and cold, it will sort of vanish in 3-4 days. Heart attack हो सकता है, that is just a matter of minutes or hours. So that is also acute. मगर बाकी चीजें जो हैं दुनिया में जो बढ़ रही हैं, they are chronic diseases, लंबी देर चलती हैं. तो अब क्रॉनिक डिजीज अगर लंबी देर चलेगी, तो क्रॉनिक डिजीज विल लास्ट फॉर अ लॉन्ग पीरियड ऑफ टाइम. उसके लिए हमारा अप्रोच अलग होगा. जो अचानक चीज आती है उस पे आप अचानक लेबल लगाएंगे. इन अ क्रॉस सेक्शनल मैनर यू विल हैव टू लेबल, you will have to intervene, and in a cross sectional manner within a few days or within a few hours you will get to know whether you did right or wrong. मगर ये जो लंबी देर वाली बीमारियां हैं, अब लिख के थोड़ी ना आएगा. इट विल नॉट बी रिटन के कल मैं वैसे बिहेव करूंगी, परसों वैसे बिहेव करूंगी. So the disease is not going to tell you how it's going to behave in future. So the diagnosis may also change. So the Dr. Karthik, the question is, lots of comments coming in. Ratnesh Jain ji has logged in, and we note the questions from Dr. Utsav Sahu as well. Kedar Joshi ji is here. Dr. Utsav Sahu is a dynamic diabetologist from New Delhi. तो डॉक्टर उत्सव ये पॉइंट आउट कर रहे हैं, वुड यू लाइक टू टॉक मोर अबाउट दिस? द डायग्नोसिस ऑफ द टाइप ऑफ डायबिटीज मे चेंज विद टाइम. ये बहरूपिया है, इट कैन मैस्कुरेड. ये अपनी शक्ल गिरगिट की तरह बदलता है. इट कैन चेंज लाइक अ कैमेलियन. डायबिटीज तो डायबिटीज ही रहेगा, बट द टाइप ऑफ डायबिटीज में चेंज. सो इज दिस कॉमन इन प्रैक्टिस, डॉक्टर कार्तिक? एंड if let us say you are my doctor, I am your patient. Today you tell me, Sanjay, you need insulin, and tomorrow you tell me, now Sanjay, you don't need insulin anymore. Does that make you a good doctor or does it make you a bad doctor?
From a patient's point of view, probably it uh, makes a good doctor because most patients like not to get insulin. But that is a very interesting and important question, sir. One thing is that many diagnoses, or not only diabetes but in general, can be a work in progress. It is not a open and shut situation in some conditions, and diabetes is one such. So sometimes we diagnose a patient with diabetes. It simply means that blood sugar is elevated. Now, once the blood sugar is elevated, then we need to look at why it is elevated. Is it fitting into the type 2 paradigm where uh, insulin is not working, or the type 1 paradigm where insulin is not produced? And then sometimes there will be situations where insulin is produced, but it is counteracted by certain other hormones, such as growth hormone, or cortisol, or epinephrine, or glucagon, and so on. So these kind of rare situations means that we may have to um, revise our diagnosis later on. The whole diagnosis might change. So during my DM days, like, we once had a patient who had been diagnosed as diabetes. He had been taking treatment for that, but sugar did not improve much. But he also noted a change in voice. His voice had become very deep, and he described it as something like Amitabh Bachchan. I had somehow developed a baritone, manly voice. He was actually quite happy about it, but we were not really happy because that kind of voice change might mean something else. Initially, we thought it is thyroid problem, but in reality, what happened was this patient had early stage of acromegaly, and that acromegaly caused the vocal cord thickening, and that was the change in his voice. So his diagnosis was revised from simple diabetes to actually acromegaly, and eventually we treated him for that condition. So what we mean to say with it is that diabetes can be a master masquerader, and it can present in many different forms. Many other different diseases can also present as diabetes. So we need to keep our eyes and mind open so that we can pick up some rarer conditions, and that it is not unheard of to have the entire diagnosis change during the course of illness. So better way is to think of diagnosis as a work in progress.
तो ये जो वर्क इन प्रोग्रेस है, ये बहुत अच्छा आइडिया है। इट मेक्स अस अंडरस्टैंड कि डायबिटीज बदलता रहेगा। और एक सवाल आया स्टेम सेल्स का। तो यदि मोनोफैक्टोरियल डिजीज हो, एक ही बीमारी है कि एक ही तरह की सेल नहीं बन रही, देन यू कैन क्रिएट स्टेम सेल्स फॉर दैट। स्टेम सेल बनेंगी जो जाके वो काम कर देंगी। तो कुछ एक न्यूरोलॉजी की बीमारियों में, लाइक लेट अस से हंटिंगटन्स कोरिया, वहां पे एक ही तरह की सेल खराब होती है, ओनली वन टाइप ऑफ सेल इज डैमेज, सो यू रिप्लेस दैट। मगर डायबिटीज जो है दैट इज मल्टीफैक्टोरियल। तो इतने सारे फैक्टर्स हैं, a single stem cell will not be able to answer. Now, let's take this example coming in from Sindhwani Sahab, and that will put into perspective how this diabetes is a work in progress. तो एक तो सुशील साहब का एग्जाम्पल लेते हैं, and then we will contrast with a totally different example, and then we'll come back to this question: when you stop insulin, does it make you a good doctor or a bad doctor? तो डॉक्टर सुशील जी के साथ तो बहुत अच्छा हुआ। He got vaccinated, maybe for COVID, and maybe the vaccine, it was supposed to change the defense mechanism of the body. तो maybe थोड़ा सा ना वो stray goal हो गया, like instead of hitting the goal post वो थोड़ा सा बाएं दाएं हो गया, तो maybe it affected the beta cells. तो सुशील जी got into trouble and then he got diabetes. He had to take insulin for 2 months. After that, the beta cells have started working again. The C-peptide is 2.08, HbA1c is 5.6, and he is not taking medicines. So the doctors told him that he is in remission. तो एक तो सुशील जी, congratulations that you've come out of it. दूसरा, well done to your doctor, he helped you. But सबसे ज्यादा शाबाशी तो आपको होगी. You must have worked a lot on your diet and exercise and your lifestyle. So 3 cheers for Sushil. So here, Dr. Karthik, the question is, what kind of a disease would Sushil ji have had? Is it type 1.5? Is it type 2? What is it? What would have happened most probably?
Uh, I I think it is likely to be just common garden type 2 diabetes, but in the pandemic period, many of us must have gotten checked more frequently than otherwise. So the pickup rate would have been higher. So it's likely that it is just type 2 diabetes. The vaccine inducing autoimmunity is much less likely than the actual infection-inducing autoimmunity. And if infection-induced autoimmunity or direct infection of pancreas, then those many studies are there. In fact, we have seen 3 cases of uh, pancreatitis with COVID, COVID-inducing direct pancreatitis. So it is quite possible that such uncommon entities can occur, but they are very less likely to remit within 2 months. Even with Middle Eastern respiratory syndrome, the virus that happened 10 years back, some patients went into remission after a median time of 8 to 9 months. But within 2 months, if somebody is going into remission, that remission can be credited to Dr. Saab himself, his own diet, exercise, along with the medications that he must have taken. And it is quite possible that he had just regular type 2 diabetes and that went into remission with excellent management. That is what I think.
तो मोस्ट प्रॉब्ली सुशील जी ये टाइप 2 डायबिटीज रही एंड बड़े सारे स्ट्रेसर्स होते हैं देयर कैन बी मेनी ट्रिगर्स which sort of precipitate type 2 diabetes. So it might have been the stress of the COVID pandemic and it also might have been the vaccine, but vaccine से ज्यादातर नहीं देखा गया. Proper COVID-19 की infection से बहुत diabetes देखी गई because that is also a stressor. But now that you've taken care of yourself and GAD is negative, so it means type 1 नहीं है. So probably this is type 2 in remission. And as long as you keep a healthy lifestyle, as long as you follow a healthy lifestyle, your sugar will also behave in a healthy manner. और weight मत बढ़ने देना. Make sure you don't allow your weight to go up. अब इसका दूसरा एक opposite तरीका लेते हैं. Let's take another example. और ये example है of a young person who develops type 2 diabetes. Glucose keeps on increasing gradually. Today 7%, tomorrow 8, day after 9. Today the patient takes 2 drugs, tomorrow 3, day after tomorrow 4. That means हर साल के साल शुगर बढ़ती रहती है. Now the patient is at 5 tablets per day. Doctor request करते हैं please take insulin. Patient मना कर देता है. Patient says no. मेरी OPD में, in my OPD, patient says yes to me. But the moment he goes out, then there is somebody from complementary therapy, from alternative therapy. Somebody telling him, ये मत लो, वो मत लो. Don't follow the doctor. तुम ये जड़ी बूटी ले लो. You take such and such a herb. 6 months, 1 year, 1.5 years, I keep on trying my best. Patient doesn't listen. HB1C is 12. After 1 year, the patient comes back and says, Doc Saab, now I'm off all my medicines. My HB1C is 7. And see, you had kept on telling me to take insulin last 2 years. I have not taken insulin at all. And my glucose values are fine. But फिर हम पूछते हैं, your glucose values are healthy, but are you healthy? And answer आता है, नहीं डॉक्टर साहब, I am not feeling well. I can't see properly. I can't walk properly. That is a separate matter. So why has this happened? What are the other things you would look at in the biochemistry? And Dr. Karthik, can you explain this? How common is it in your practice and what is actually happening to this patient?
It is quite common for patient to go into some kind of automatic control or auto control of diabetes. This is most commonly occurs with development of diabetic nephropathy, where the kidneys are not able to excrete whatever insulin the patient is producing. Consequently, the insulin does its job and sugar gets controlled, but at the expense of reduced GFR and a kidney disease. Apart from that, if this same patient has had frequent episodes of hypoglycemia, then we may also suspect other endocrine conditions such as hypothyroidism or Addison's disease. Similarly, it is less common in the southern part of India, but where Kalra sir is working, probably he sees much more of it. The celiac disease, where the patient is gluten sensitive and stops taking food or reduces the staple food and consequently loses weight and gets into automatic control. Apart from that, if no hypos are there and wildly just swinging blood glucose is there, it could also be a pointer towards diabetic autonomic neuropathy, which again can present with relatively normal HbA1c, but a patient who is not feeling all right. So it could be other endocrine conditions, kidney not working, or even the diabetes going to such an extent as to affect the autonomic nervous system. So it is not always a good sign that blood sugar and HbA1c is normal. It could be actually a bad sign.
हम्म. तो जब डायबिटीज में कॉम्प्लिकेशन आती है, जैसे किडनी खराब हो गया, लिवर खराब हो गई या पेट खराब हो गया, आंतड़ियां, तो शुगर लो होती है. Let's repeat that again. Three medical causes of sudden improvement in glucose levels, even though the patient is unhealthy: kidney disease, liver disease, and gastrointestinal disease. किडनी और लिवर का काम होता है दवाइयों को तोड़ना, टू मेटाबोलाइज द मेडिसिन. एंड अगर आपका किडनी या लिवर काम नहीं कर रहा, द मेडिसिन विल नॉट गेट मेटाबोलाइज. जो आपने दवाई 4 दिन पहले खाई थी, द टैबलेट विच यू टुक 4 days ago, दैट विल स्टिल कीप ऑन सर्कुलेटिंग इन योर ब्लड. पिछले 3 दिन आपने और दवाई खा ली, यू केप्ट ऑन टेकिंग योर मेडिसिन, एंड ऑब्वियसली विल गो इनटू हाइपोग्लाइसीमिया, एंड यू विल थिंक द शुगर्स आर फाइन व्हाइल एक्चुअली द लिवर और किडनी आर सिक. गैस्ट्रोइंटेस्टाइनल इम्पेयरमेंट, पेट में या आंतड़ियों में खराबी, any disease in the stomach or in the intestine. One example is celiac disease. Other examples would be malabsorption, diabetic gastroparesis, diabetic diarrhea. अगर खाना हजम ही नहीं होगा तो शुगर लो होगी. That is autonomic neuropathy. But actually मरीज खुश नहीं है, ठीक नहीं है. Three endocrine causes which Dr. Karthik has mentioned: hypopituitary, hypothyroid, hypoadrenal. All these can lead to hypoglycemia. So patient may get a false sense of security, but that is actually false. अंदर से तबीयत खराब हो रही है. सुशील जी जो पूछ रहे थे, GAD is negative, am I at risk for the future? I think Sushil ji, as long as you keep your lifestyle sattvic, your sugar will also remain sattvic. So don't worry too much about it. Lifestyle modification वो part of life बनेगा. Dr. Karthik, we have one 73-year-old young person with us. Sir is our senior, Dr. Rameshpal Singh Pawar, sir. He was diagnosed to have pre-diabetes 1 year ago. So I think the first thing you and I should do is we should ask him, sir, how to remain non-diabetic until age 72. So that sir should be teaching us. This happened during COVID. Now he takes metformin 1000 grams per day. Fasting glucose is 90. HbA1c is 7 at the age of 70 plus. Daily exercise is 1 hour a day. Anything extra that sir should be doing?
I think it's all fine, sir. Our HbA1c targets are individualized, and for sir, it's by God's grace and his own efforts, it's in the acceptable range of 7%, and he's able to do perform his daily exercise and live a very active life at the 70 plus age. So I think everything is fine, and there's no need for us to actually intervene or do any changes at this moment.
एक्चुअली डॉक्टर पवार सर, जो मेटफॉर्मिन आप ले रहे हैं ना, आप उसको दवाई भी ना समझें. डोंट इवन थिंक ऑफ इट लाइक अ मेडिसिन. इट इज जस्ट लाइक हाइजीन. So the same way you would get up in the morning, you would brush your teeth, you would shave, you would take a bath. That is part of hygiene. You don't consider that that is a burden on life. Similarly, metformin and some other new drugs, we will ask Dr. Karthik what those are. इनको तो hygiene का हिस्सा माना जाता है. So it's just for metabolic hygiene, ताकि sugar बढ़े ना, so that sugar doesn't rise, ताकि कल को कोई complication ना हो. The same way that you would want to take a bath every day, so that you don't develop a skin infection tomorrow. Right, or you would want to shampoo your hair, उतना ही आप दर्जा दें metformin को, neither more than that nor less than that. So you just take it like brushing your teeth or taking a bath. So if we've introduced this concept, Dr. Karthik, and we have Dr. Bhalchandra Meshram logged in with us and Sunny Grover Sahab from Haryana, तो question ये आता है कि if you've introduced the concept of metabolic hygiene, then what is the concept of sleep hygiene? Why is sleep important, especially for young people with diabetes?
Sleep is one of the most neglected parts of our healthcare approach. Sleep has to be emphasized to all patients with young diabetes, not only young diabetes, for any diabetes patient. We need to get 8 hours of sleep. In fact, one of the studies showed it in a very dramatic manner. In the Western countries, they have something called the daylight saving time. So during their winter and summer months, they may get 1 hour less sleep or 1 hour more sleep. So what they found was that just after the daylight saving time changes, the 1 hour less sleep day, there is a sudden spike in MI actually. On the next day after an entire population of let's say 3 million people lose sleep, they find that the increase in MI is so significant that it shows up as a spike. So this tells us how important it is for us to get both the right quantity and the quality of sleep. And one of the problems, especially in secondary diabetes, could be the presence of obstructive sleep apnea. So we need to ask two questions to every diabetes patient who comes to us, especially those who are overweight. Are you snoring? Are you feeling sleepy in the daytime? Like, for example, sitting in front of TV, he's just sleeps off. Or some of these patients can be so severe that if the signal, if the red signal falls and it, if they have to wait for 1 or 2 minutes, they might just sleep on the steering wheel itself. So it can be as severe as that. So it is very important for us to ask these two questions. There are, of course, stop bands, several questionnaires are there, but these two basic questions will tell us whether there is any obstructive sleep apnea which is causing disturbance of sleep. Secondly, we can also ask for the partner, the patient's wife, whether he is snoring and whether have you witnessed any episodes of apnea. In fact, of late we have seen some patients undergoing what I might call as sleep divers. The husband is snoring so much that he's asked to go and sleep in some other room. In a Western country, this might have resulted in actual divorce. But since this is India, especially out of place, that is out of question. So these guys have something called sleep divers. They will just go and have to sleep in some other room. So such is the severity of the condition. So we can also ask for if the patient has something like a sleep divers kind of situation. So it is very, very important for us to assess sleep actually.
तो स्लीप हाइजीन इंपॉर्टेंट है, जैसे डॉक्टर साहब ने कहा. इफ यू डोंट स्लीप वेल, यू डोंट गेट द राइट क्वालिटी, द राइट क्वांटिटी ऑफ स्लीप, अगले दिन सुबह आपकी शुगर बढ़ेगी बढ़ेगी, द फास्टिंग ग्लूकोज विल बी हाई. हिंदी में अगर कहें, जो दिन की शुगर है उसका दिनचर्या से लिंक है. योर डे टाइम ग्लूकोज इज वेरी क्लोजली लिंक्ड टू योर डे टाइम रूटीन, टू योर डेली रूटीन, दिनचर्या. और जो खाली पेट शुगर है, फास्टिंग शुगर है, उसका दिनचर्या से इतना लिंक नहीं होता. देयर इज अ लिंक बट नॉट सो स्ट्रॉन्ग. उसका रातचर्या से लिंक होता है. दैट मीन्स योर लाइफस्टाइल रूटीन, योर नाइट टाइम रूटीन. आपकी नींद की क्वालिटी कैसी है? आप रात को ड्रिंक लेके तो नहीं सो रहे? फुल क्रीम मिल्क तो नहीं पी रहे 1 लीटर? आर यू टेकिंग 1 लीटर ऑफ फुल क्रीम मिल्क? दैट इज क्वाइट कॉमन इन माई स्टेट. एंड आप नाइट शिफ्ट वर्कर तो नहीं है. So these would be things that would influence the fasting glucose. And डॉक्टर साहब ने एक बहुत इंटरेस्टिंग चीज बताई, दैट इज स्लीप डाइवोर्स. तो वैसे तो एक ही घर में रह रहे हैं, एक ही छत में रह रहे हैं, अंडर वन रूफ, बट कमरे अलग हैं बिकॉज नोबडी कैन टॉलरेट द स्नोरिंग. दिस इज अ साइन ऑफ OSA, ऑब्स्ट्रक्टिव स्लीप एपनिया. एंड एक और नया नाम है जो अभी ज्यादा पॉपुलर हो रहा है, दैट इज सोमनो मेटाबॉलिक सिंड्रोम, विच टॉक्स अबाउट मेटाबॉलिक सिंड्रोम एंड स्लीप का इंटर रिलेशनशिप. यदि नींद नहीं ठीक आ रही तो अपने डॉक्टर से बात करें. और स्लीपिंग पिल्स पहले दिए जाते थे जो बेंजोडाइजेपिन पिल्स थे, जो एडिक्टिव हैं. बट नाउ वी हैव गुड ड्रग्स व्हिच आर नॉन बेंजोडाइजेपिन पिल्स. वन एग्जांपल वुड बी लेम्बोरेक्सेंट एंड अनदर वन वुड बी ज़ोलपिडेम. सो दीज आर ड्रग्स वी कैन यूज. सनी ग्रोवर जी पूछते हैं, आपने दिनचर्या की बात की, यू स्पोक अबाउट डेली रूटीन, मगर ऋतुचर्या, दैट मीन्स द वेदर, द सीजन्स रेदर, the seasonal variation, does that have any impact on glucose control?
Seasonal variations can have impact on sleep quality, vitamin D levels, and can indirectly affect blood glucose levels. But uh, as to direct effect, probably circadian rhythms have a much stronger effect on blood glucose than longer term rhythms like seasonal rhythms. That being said, where I live, we only have one kind of weather: hot, hotter, and hottest. So
Hottest in Chennai.
I think the Kalpa sir is the better person to answer this. We don't see any cold.
डॉक्टर कार्तिक जो हमें बोल रहे हैं वो है कि चेन्नई में, पौंडीचेरी में 3 तरह के मौसम हैं. गर्मी, बहुत ही गर्मी. सो हॉट, हॉटर, हॉटेस्ट. बट नॉर्थ में यू डू सी अ चेंज इन कोमॉर्बिडिटीज. सो डॉक्टर उत्सव, डॉक्टर रमेश पाल, आई एम श्योर दे आर ऑल फेमिलियर. विंटर में बीपी बढ़ता है, बीपी विल गो अप बाय 10. You have to increase the diuretic dose. Risk of heart attack and stroke goes up in winter. Summer में dehydration, skin infections, gastrointestinal infections, DKA, diabetic ketoacidosis, all this goes up. So actually morbidity profile, that means sickness profile का भी बहुत link है with summer and winter. We have more emergencies in summer and we struggle more in summer. एक और ये reason ये है कि गर्मी में कई बार हमारी इंसुलिन भी खराब हो जाती है. Because people do try to store it properly, but sometimes it is so hot that I mean, sabji kharab ho jati hai, the vegetables spoil, bread kharab ho jati hai, bread gets fungated. So insulin is no exception. But Dr. Karthik, it's been great being with you today. Uh, our topic for today was 14th of November, एजुकेशन टू प्रोटेक्ट योर टुमारो. वी आर वेरी हैप्पी कि सुशील जी ने अपना केस शेयर किया हमारे साथ. सिंधवानी साहब shared his case with us, and he's in diabetes remission now. So that gives us confidence that all of us can actually improve our metabolic health. And we've learned so much, especially about the types of diabetes in the young and how we can manage them. We have people logged in from across the country. And Dr. Karthik, is there anything you would like to say to everyone on this occasion of World Diabetes Day?
I first of all like to thank Kamra sir for this opportunity to talk to people across this country. As the today's theme suggests, we need to educate and empower our patients to aim for the highest. Just like India is nowadays aiming to be a global superpower, if not a regional superpower, we should also be aiming for the highest, which is diabetes remission in any young patient should be the primary goal unless otherwise stated. So we must aim for diabetes remission in any young patient with type 2 diabetes. At the same time, we should make our type 1 diabetes patients very well supported so that we close the care loop for the type 1 diabetes patients. We may or may not be able to offer closed loop solutions, but we can always close the human loop where the patient has feels valued and supported and empowered through his type 1 diabetes journey. So for type 2 diabetes, our my if I can say a message would be to aim for the highest, which is remission. For type 1 diabetes, is to close the human loop.
तो ये जो डॉक्टर साहब के कमेंट्स हैं बहुत ही वैलिड हैं. एम फॉर द हाईएस्ट बेस्ट पॉसिबल क्वालिटी ऑफ केयर. तो हमारी जिम्मेवारी भी बनती है. इट इज आवर रिस्पॉन्सिबिलिटी टू ऑफर द बेस्ट पॉसिबल केयर एंड एजुकेशन. और सबका हक भी है. इट इज एवरीबॉडी राइट्स, everyone's right to get the best possible care. And these rights and responsibilities will be fulfilled only if we talk to each other, if we communicate with each other, if we relate to each other. So the right, the responsibility, and the relationship all are important. नॉर्मली हम सबको करते हैं शुक्रिया, धन्यवाद, मेहरबानी. आज एक और लफ्ज नंदरी. थैंक यू डॉक्टर.
Thank you, sir. Thank you.
जो हिंदी भाषी लोग हैं हमारे साथ, स्वप्ना जैन जी हैं, who speaks both languages. स्वप्ना is from Vellore, patient advocate. तो स्वप्ना जैन जी चैट बॉक्स में लिखें तो सही, नंदरी का मतलब क्या होता है और वाणिकम का मतलब क्या होता है. लेट स्वप्ना जी आंसर फॉर अस. मैडम इज फ्रॉम वेल्लोर. In the meantime, Pratik is with us backstage. Pratik, what is thank you in Sindhi? बताओ तो सही हमें chat box में. And can we show a certificate of appreciation for Dr. Karthik, please? So thank you, Dr. Karthik.
Thank you, sir. Thank you.
And Swapna Janji says Nandri is thank you and Vanakam is welcome. We keep on working hard at KK Med Talks to improve the health of everyone living in India, each and every one of our fellow citizens. And one very strong pillar of society that we have is our police force. So on this occasion of World Diabetes Day, we'll be going out to our policemen and women. And Pratik, could you please show a flyer for that? So over the next few weeks, we will be doing this FIR, First Information Investigation Report for diabetes. We'll be going out to police thanas across the country. We'll be checking their glucose, their blood pressure, and their body mass index. And these diabetes awareness camps will be conducted by senior diabetologists and endocrinologists across the country. This checking of glucose, BP, and BMI will also be associated with or will be followed by an awareness talk where we'll spread the message about good health, about diabetes care. तो इसके लिए हम थैंक यू करना चाहेंगे IJCP ग्रुप का, जिसने ये आइडिया फ्लोट किया, और USV फार्मा का, जिसने इसको प्रमोट किया. And with this, once again, I'd like to thank everyone for having logged in and joined us. I'll meet you again next Thursday. हमारे गेस्ट होंगे डॉक्टर BK ठाकुर, and we'll be talking about eye health across all ages, बचपन से लेके बुढ़ापे तक. So that will be our topic for next KK Med Talks. तब तक आपसे इजाजत देते हैं. जैन जी again saying a vanakkam to you. अरे एक last question, Dr. Karthik, if you allow, in just 1 minute. Dr. Kedar Joshi sir is Kedar Joshi ji is 67 years young. Total cholesterol 188, triglyceride 173, HDL 46, LDL 108. Joshi sahab is a yoga enthusiast, no other disease. तो डॉक्टर साहब आपको पूछ रहे हैं वो, do I need to increase my HDL? HDL is 46. That's the first question.
No, sir. It is already fine, and that increasing HDL beyond this point will not offer any additional advantages. So, one is that. Second is that it is very, very hard to increase HDL. There are only two things which can increase HDL. One is exercise, which, as a yoga enthusiast, I'm sure sir is
Already he's
already
doing.
doing.
Yeah.
And second is alcohol, which we do not generally recommend. That is
लेकिन
red wine.
ये
So that is not something we would recommend. So
जोशी
as and thirdly, his HDL is already good for us. So there
yeah.
is no advantage of increasing HDL.
और तो जोशी सर वो जो अल्कोहल वाला पार्ट है वो तो कार्तिक मैं और आप हम सेम बोट में हैं which is a very सात्विक kind of a boat. LDL is 108. So यहाँ पे maybe the jury would be out, but should sir begin a medicine for that or not?
Sir is not having any disease,
Heart
no
disease.
diabetes, no hypertension. So LDL of 108 is perfectly fine for his age. And I personally feel sir is blessed either because of yoga and he's got some good genes as well. So there is nothing to do actually
जो
with regard to
चल रहा है तो बहुत बढ़िया चल रहा है. Everything is fine and you continue whatever you're doing. So with this, once again, I'd like to thank you. Sarabjit जी, allow करें कि ये question आपका next time ले लेंगे. Diabetes and the gut microbiome. इसको लंबी देर में लेंगे डिटेल में. And रति गुप्ता जी को thank you for joining us. Once again, सबको बहुत-बहुत शुक्रिया ज्वाइन करने के लिए. And दोबारा आपको मिलता हूँ वीरवार को जुमेरात को. तब तक के लिए जय हिंद.
Thank you.